Now is the gentlewoman from Illinois, Ms. Schakowsky.
Thank you, Mr. Chairman. I'm so glad that we're starting off the second session of the 110th Congress in this committee with such an important topic, the provision of long-term care for low-income individuals and individuals with disabilities. We have a lot to discuss today and some wonderful witnesses to hear from, but I do want to take a moment to just recognize and thank all the advocates who have joined us here and around the country. You've worked long and hard for this day, and it's because of you that we're here. I thank you for being here or listening in, and thank you for your tireless work. While we're having this hearing in a health subcommittee, actually it would be appropriate if this were a human rights or a civil rights hearing as well, because these issues extend into the whole area of quality of life. I have in my office over my shoulder a drawing of Justin Dart, really the father of the independent living movement. And I want to recognize Yoshiko, his wife, who is here today and has carried on that legacy as all of you are representing today. As the primary source of public financing for long-term care services and support for low-income individuals and individuals with disabilities, Medicaid provides long-term care services and support for over 8 million non-elderly people with disabilities and 5 million seniors, many of whom have disabilities. With the increasing demands of an aging population, a generation which is expected to live longer than ever before, the ability of Medicaid to provide quality, appropriate long-term care services is essential. And while the majority of Medicaid dollars used to serve this population still goes to institutionalized care, there has been both a shift in spending and an interest in directing more of those dollars toward home and community-based service. This is an important trend and one that as a committee we must listen to. Individuals with disabilities want to and deserve control over where and how they receive care and support services. But the question shouldn't be just one of institutional care versus community care, but rather of providing the resources and choices that people need throughout the entire continuum of care so that people get the care that they need and that they desire. Unfortunately, what we're seeing is an administration that prefers to reduce the pot for all rather than expand it. The Olmstead decision reflected the need to provide a full range of choices across the continuum, and I'm glad that we'll be discussing the Community Choice Act, which I know is of great importance to many of my constituents. I'd like to request, Mr. Chairman, for unanimous consent to include Congressman Danny Davis's statement for the record. He is a sponsor of this bill, which would provide alternatives to institutions and support the momentum for individual choice.
So ordered.
Unfortunately, rather than moving in that direction, this administration is trying to limit those choices through misguided regulations. Though a number of states that use the Medicaid rehabilitation services option to serve people with mental illness has increased significantly in recent years, the administration has issued a regulation that would place serious limitations on the kinds of services allowed under this program, effectively restricting the rehabilitation services available to people with mental illness. The administration has also issued a regulation to reduce the capacity of case management services for children in foster care and people with disabilities, services which help beneficiaries access needed medical, social, educational, and other services that help them re-enter or remain a part of their community. And finally, I want to also mention the administration's efforts to terminate schools' ability to serve children with special needs by eliminating reimbursement for transportation services. These regulations are offensive and misguided, and I look forward to addressing them as soon as possible. Again, I want to say how grateful I am for the advocates. I also welcome all of our witnesses and look forward to hearing from them. This is an extremely important discussion that we'll have today. And with that, I yield back, Mr. Chairman, and thank you very much.
Thank you. The gentlewoman from Oregon, Ms. Hooley.